Hi, I'm Jason Bellamy here at NSC 2013 in Louisville, Kentucky. I'm joined by Debbie Ingram. You just finished a session on professional attire, maybe I should say unprofessional attire, and the difference between the two. First of all, tell me about the beginning of the session. It was pretty fun. You guys had a fashion show. Describe that.
We had 24 student models from 4 different programs, and they came dressed in things that would be considered appropriate professional attire. Things like scrubs, a lab coat over street clothes, khakis, polo shirts, and business suits. And then we had those things that would be unprofessional attire, including nightlife clothes, high-heeled spiked shoes, visible tattoos, facial piercings, and blue hair. So it was crazy attire today at National Student Conclave.
So if I'm young, if I'm a student, I might think, okay, well, who gets to define crazy? Who gets to define that? And, you know, I suppose there are some societal norms, but beyond that, you've done some research really that shows what kind of where that line is drawn. So tell me about that research.
Sure. The impetus for this the studies that I've conducted comes out of the medical literature, because patients prefer that physicians wear more formal attire, and that attire includes a white lab coat. But so much of the literature right now is indicating that these lab coats are actually have bacteria on them as you go from room to room, so it becomes an infection control related issue. So, and oftentimes when people wear lab coats, they don't take them home to wash them on a regular basis. So we looked at what it is that physical therapists should be wearing, because our job's different from that of a physician in that we are constantly having to hold patients, provide assistance to them, bend, climb in the floor, climb up on the bed, and physically get them in and out of the bed and in and out of a chair and some of those things. So what we need to wear needs to be something that we can bend and move. So we did 4 studies. The first one, we asked patients to look at 6 pictures of a male physical therapist and 6 pictures of a female physical therapist, and to choose which ones they had confidence in that individual. We had everything from the business suit to the lab coats to the ties on the males, and scrubs and shorts in one of the pictures, or cut-off pants for a female. And what we found is that the patients had confidence in the individuals, the most confidence in those individuals with scrubs and khakis with a polo. And then the perceived practicality also indicated that they thought that those 2 things were the ones that were the most practical things for physical therapists to wear. So we then interviewed, through a survey instrument, our clinical sites and the directors at our clinic sites, and asked them what they thought was the most practical and the one that they most preferred for their settings. And the clinic directors said their most practical and the most preferred were the khakis and the polo. The patients' most practical and preferred were the scrubs. So we found a difference between the 2 groups. After we finished those 2 studies, we looked at the literature in regards to image, other images, things such as the facial piercings and tattoos, visible tattoos, unnatural hair color, blue hair, and several other things. And we decided to conduct the surveys of our clinic directors and our patients. And we had a couple of hundred patients respond, and then we had almost 100 of our clinic directors respond. And the number one thing that they least preferred of all of them, but whether it was the clinic director or whether it was the patients, were facial piercings. So big take-home message to the physical therapy students out there is remove those facial piercings, especially before you go into a clinical environment, because 83% of what people remember about you was what they saw. And they don't like it. The second major take-home message is that people have preferences that are different based upon age, based upon socioeconomic status, based upon location. So the second major take-home message to all of the clinic directors and clinicians out there would be find out what your patients prefer and then attempt to try to model that same in your clinical setting.
And so really to go back and kind of highlight some of that and translate it, the point is this isn't just about how to make sure you get employed, what you want to look like to get the right job. The point is trust is so crucial in physical therapy. And essentially it's about actually doing your job better, that you're going to be judged and evaluated on what you're wearing, and that's going to translate into the patient's opinion of the kind of care that they're getting. That's great, right?
That's exactly right. And what the literature said is that patients will make confidence decisions based solely on pictures of what people look like. So if they're going to make those decisions based upon pictures, you know they're going to make those decisions when you walk into that room.
Absolutely. Debbie Ingram, thank you so much.
Thank you.
We're going to be doing other dispatches like this from NSC. To watch them all, go to ape.org/NSC/video. I'm Jason. Thanks for watching.